Hawaii's breathtaking landscapes and vibrant culture often mask a harsh reality. The crushing weight of its cost of living is pushing many working residents into a mental health crisis. New research from the University of Hawaii, Manoa, highlights a disturbing link between financial struggles, particularly food insecurity, and deteriorating mental health. For many, the stress of simply affording basic necessities is not just an economic issue. It's a matter of emotional and psychological survival. Among the various socioeconomic pressures affecting mental well-being, food insecurity stands out as the most powerful predictor of depression, low self-esteem, and even suicidal thoughts. When residents are forced to choose between rent and groceries, the psychological toll is immense. The study found that nearly 40% of working-age adults surveyed reported symptoms of depression, a strikingly high percentage that underscores the emotional strain of living in an environment where financial instability is common. Even those who can afford food and shelter are not immune. High housing costs alone are linked to increased mental distress, regardless of income level. Hawaii's economic squeeze is only getting tighter. The cost of basic survival for a family of four has ballooned to over $107,000 per year, placing enormous pressure on households. Many dual-income families, once considered financially secure, are now turning to food banks for help. The Food Basket, a Hawaii island-based food bank, is seeing levels of demand comparable to the worst months of the COVID-19 pandemic. Parents who work full-time are still struggling to put food on the table, an unsettling reality that exposes the widening gap between wages and living expenses. While the study identifies certain protective factors that can help buffer against mental health struggles, such as stable employment, long-term relationships, and safe neighborhoods, these are not solutions to the deeper crisis at hand. The fundamental problem remains. Many Hawaii residents are fighting to survive in an economy that is failing them. Without aggressive policy changes to address skyrocketing food and housing costs, mental health interventions alone will not be enough. The takeaway from this research is clear. Food insecurity is not just about hunger, it is a major driver of mental health decline. Hawaii's cost of living is doing more than emptying wallets. It is eroding the well-being of its people. Policymakers must recognize that economic hardship is a public health issue and take bold steps to ease the financial pressures suffocating working families. If meaningful action is not taken, the state risks deepening a crisis that extends far beyond economics, one that threatens the mental and emotional resilience of an entire generation.